For a Monday, anyone in France going to a restaurant, hospital or taking a long-distance train journey will have to prove they've been vaccinated against COVID-19 or have recently tested negative. The country is one of several implementing or considering vaccine passports as part of a transition out of pandemic lockdowns. Many companies are also insisting their staff are vaccinated before returning to the office, and some are even offering cash incentives. Sarah Morice takes a look at vaccine passport programs around the world.
Last weekend, around 200,000 people took to the streets across France rallying against the health pass, the country's version of a vaccine passport. They say it violates their liberty. Since July the 21st, only people with the pass have been allowed into public buildings like libraries, museums and swimming pools. And now the rule will be extended to include restaurants, trains, planes and even hospitals. Restaurateurs estimate it will drive away 15 to 30% of their diners.
Not only will we lose all our customers, but if a customer refuses to show their pass, what do? Do we call the police every time?
Hospitals say enforcing the new rules will place a huge financial burden on the healthcare system.
Often hospitals have several access points. We will have to recruit extra security staff to cover all these entrances. We believe the cost of doing that will be around $71 million a month.
France isn't the only country implementing a vaccine passport. From Friday, Italy's Green Pass will be required to access venues like restaurants, cinemas, stadiums and museums. To get the certificate, a person must have had at least one dose of a vaccine, have recently recovered from COVID-19 or have tested negative for the virus in the past 48 hours. The UK plans to introduce a similar health pass by the end of September, which will be required to get into nightclubs. It may be expanded to cover universities and sports events too. In Ireland, people already have to prove they're fully vaccinated or have recently recovered from the virus to enter restaurants and pubs. On TikTok, French President Emmanuel Macron has justified the implementation of the vaccine passport.
If we didn't have the health pass today, we would be obliged to close down again, which would put a burden on everyone. With the health pass, we only put the burden on those who haven't been vaccinated yet.
Governments aren't alone in mandating inoculation. Tech giant Microsoft has announced all staff and visitors entering its American buildings will have to show proof of vaccination. There are similar policies at Google, Facebook and Tyson Foods, the world's second biggest meat processor. Asset management company Vanguard is going a step further, offering to pay $1,000 to every employee who gets the jab. Vaccine passports are not a new concept. Some countries refuse entry to travellers who aren't inoculated against yellow fever. Others, like Australia, withhold welfare payments from parents of unvaccinated children. But every time the shots are made mandatory, it raises ethical questions, a dilemma many countries and businesses around the world are now facing. Sarah Morice, TRT World.
For more on this, let's bring in Dr Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter's Medical School. He joins us now from Cornwall in the UK. Good to have you back on the program, Doctor. Firstly, France's top court has just approved President Emmanuel Macron's proposed law that would force people to either have a negative PCR test or proof of vaccination in order to participate in everyday life, including access to bars, restaurants, cafes and cinemas. We know it's been the subject of mass protests across the country. What do you think of this idea of vaccine mandates? Are they the solution to get a community, a country out of this pandemic?
I don't think so. I have been in the business of immunizing people for over 30 years, and my experience is you take the people with you. Force is never good in these circumstances. I appreciate in sensitive clinical settings, we want healthcare workers, etc., to be fully immunized. But my approach is always inform, advise, educate, and enable people to make that decision and come with you.
Further to your point, critics have argued that people should be encouraged or even incentivized rather than coerced. But people like Emmanuel Macron and also leaders in Italy, which is proposing a similar scheme, they argue in order for the wider community, for the greater good to benefit, these almost forceful measures need to be implemented. What would you say to that?
They've got it wrong. They have not been in the business of public health, and they have not got the best of advisors, or if they have got the best of advisors, which I think they have, they're not listening. Forcing does not work. Forcing alienates people, and people are, this is a long journey, and because this is a long journey, you don't look for short-term fixes. You look for how I'm going to have credibility and acceptance and tolerance by the largest number of people over the longest period of time. So my view would be for President Macron and the leader for Italy, and if it happens in the UK, is talk to the people, invest in the people, allay their fears, allay their concerns, and allow them to make the free choice.
On a smaller but also significant scale, we have more and more businesses, more and more companies who are also requiring their workers to be vaccinated in order to work within the organisation or to even work full stop. I mean, what do you say to those private businesses? Is it perhaps more permissible for them to require that, given that in an office environment, people could be working shoulder to shoulder?
Yes, I can see how Microsoft and other offices, businesses wish to have that policy. My view, again, is it is better to talk to your workforce, better to educate, inform them, and allow people to make free choices. Because remember, there may be people who are concerned, worried, misinformed, and by forcing them, you are not addressing their worries. And it is very important to address their worries and then allow people to make the free choice to be immunized.
Can I ask you more broadly about the pandemic? Because, as you know, we are seeing a surge in Delta outbreaks in the UK, but pretty much in most parts of the world right now. There's this argument that, particularly from the World Health Organization, that countries should not be distributing booster shots right now, given that so much of the world hasn't even received a single COVID-19 vaccine. What's your view? Should countries, or richer countries that have access to booster shots, should they be giving them out to their populations?
So I'm with the World Health Organization. The evidence for declining immunity 1 year after being immunized, and therefore the need for boosters, is very tenuous, if at all. Therefore, the evidence is not there that you really need the boosters. On the other hand, there is a lot of evidence that Africa, Asia, South America, and many poorer parts of the world are desperate for the vaccines. So talking as a global health public doctor, I would say better you donate your vaccines, better you enable poorer nations, poor countries all over the world to immunize, rather than you keep on immunizing your people and boosting their immunity.
Okay, Dr Bharat Pankhania from the University of Exeter. We'll have to leave it there, but it was really good to get your analysis as always. Thank you for that.
Thank you.